not all of the payments that a patient makes, they don't post directly to the appointment. So
Mm.
somebody still has to be like monitoring a page for a lot of those payments and saying, "Oh, we just got a payment. Let me like associate it to the right appointment." So we're like, we can't do that.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense. And without all the acronyms, we talk to people on the front lines of healthcare and explore cool workflows they're using to solve real problems. I'm Angie, product leader at Luma Health, and I own all things patient access.
Hey everyone, I'm Dave Smythe. I'm a revenue leader at Luma. I have the great pleasure of working with all of our customers and those that are curious about what Luma might be able to bring to them. Justin?
Hi, I'm Justin. I am a product leader at Luma as well, and I work on our intake solutions, all things payments and insurance.
And today we have a returning guest, best friend of the show and tech powerhouse from DENT Neurologic Institute in upstate New York. She manages all things EMR and technology systems, and we're so excited to have her back. Welcome back, Emily.
Thank you. I was just waiting until you guys asked me to be back on again. Highlight of my life. So thank you.
Okay, Casey, that's there. But it's more, we didn't iron out the warm-up questions. Lazo put not sure if we can talk about this. It was like
We
Buffalo
will.
Bills.
Let's just talk about it.
Yeah, I'll speak off the cuff too. So if anything's like, ooh, just cut it.
Or Dave, why don't you guys talk about sports? You guys were already doing it.
I don't know if we should talk about sports. As everyone knows, Dave is a Red Sox fan. I'm a Yankees fan. I don't think we should start the podcast with hostility. Maybe we should find a common sports team that we all like. But
Like
yeah,
the Bills. Like the
No.
Bills.
we can talk about the Bills. Everyone here,
Or Utah Mammoth.
Utah Mammoth, are they good?
They're just the Utah hockey team.
Yes. The Bills, I just want to say I'm not worried at all about our week 5 loss to the Patriots. I think we had to do it, get it out of our system, and we are going to win the Super Bowl.
You lost to the Patriots?
Yeah, you know what? It was bad. It wasn't good. I don't appreciate the laugh, you know. We'll talk in February, Justin. I don't think does Utah have a professional sports team?
We have 2, 3, if you count soccer.
Jazz, that's one. Go Sports.
Yeah,
Go
Utah.
The
Sports.
Jazz, the Mammoth, and then technically Real Salt Lake, but who counts soccer?
Yeah.
Well, and BYU has gotten into the pay the players game.
Well, so has every college sports team. Let's be real.
No, I know, but I'm just saying. All jokes aside, tell us a little bit about the conference and what did you walk away with? What did you get confirmation of? Any insight for folks that follow your lead?
Yeah. So the ECW conference was interesting, very eye-opening. They're definitely trying to make a lot of enhancements to clinical documentation and the provider's workflow for when they're creating them. They're going to be making a huge, huge AI push. So it's really going to be interesting to see all the EHRs try to catch up and really expand patient access, clinical documentation, all of those things.
Let's just take Fax Transform, something you know and love. That's been, a game changer for your vision.
Yes. I see Angie smiling over there because she's the fax queen. I think Angie's team has done a wonderful job.
We were checking recently on some data of your data accuracy when you first started with us to literally the last 30 days. And the numbers are so high now for all patient matching, date of birth, et cetera. We're at 98% across everything, which I feel was really exciting to see the actual numbers come out more than just our feel of it every week over week.
Yeah. And we just trained another department on
Nice.
to use LumaFax. And so I did a walkthrough of it. Hey, this is what it looks like when you have to split a fax in Luma. And people were losing their minds. It was our chart prep department because they really rely on getting those records in the chart or else, they're in trouble. Their whole job is to make sure the provider has what they need in the chart. So they're, sorting through faxes and they routinely get 100-page faxes. I showed them how, Luma, they'll auto recognize, oh, the first 3 pages here look like the referral. 4 through 8 looks like it's a progress note from 2022. 9 through 11 looks like it's an MRI report from just recently. And we were showing how the Luma AI can actually recognize that. And they were literally gasping. They couldn't believe it. They thought it was sorcery. They're there's no way. Is this a live document? I'm like, yes, I'm doing it in real time. This isn't pre-recorded that we just staged for you. So there's been so much excitement as we expand the product.
Hey, one more just quick thing on the data, y'all. Any like swag numbers now of what you think it's generated and either cost savings or potential revenue?
Yes. I think off the top of my head I'll just give you, I always say this is like the stat we use.
Yeah.
Prior to Luma, somebody working the fax inbox could probably get through maybe 150 to 200 documents a day. That is being very generous. That's a seasoned person getting through 200 documents filed in a day. Because if you think about it, a lot of those have to be split up. They have to look up the patient. They have to think about, hey, this is a refill for this provider, so it's going to be assigned to this person. It's a lot of, cognitive burden
Mhm.
on these staffs. Conservative, 150 to 200 if they're a rock star employee in an 8-hour shift. Now we can have somebody go through like 150 in like an hour and a half. So
Mm.
just like the time saving, the FTE saving for that. I mean, it's really hard to keep people engaged in a job where all they're
Mhm.
doing is sorting faxes. There's so much more meaningful work they want to be doing. So the people who are really good and really fast at filing the faxes all day, they want to move on to other positions. Then we're back at square one where we're understaffed. We can't get people in those seats. And again, they want to do more meaningful work.
Yeah.
So it's also been like a morale boost too for those
Mhm.
staff. And then again, we could never stay fully staffed for those positions because the amount of people it would take for us to keep up with the fax inbox was just not reasonable, especially when we have tools to automate. It's like, why don't we essentially? And then there's the intangible things too. It's really hard to measure patient outcomes, but I'm sure there's, some surrogate measure or indirect result of, hey, this refill or this prior auth request isn't sitting for weeks. It's getting into the chart in real time so somebody can work it and the patient can either get, approved for a service, approved for a medication, they're getting their care faster.
It's amazing. Well, you dreamed big. And
We
now
did.
you've
Yeah.
delivered. So I know we're here to talk about equally the innovation and the thoughtfulness that you have had with how you think about the hard thing of payments. Hard on a patient, hard on the clinics, hard on the folks working the front desks. Yeah, I just would love for you to share with us a little bit about the business problem that led to the workflow that I know we're going to talk through. You want to just walk us through, Emily, what got you to, what was the problem?
Yeah. So similar to having staff, work these, rote tasks of filing faxes, we have a lot of receptionists that all they do is check in patients and they ask the same questions over and over and over every patient. Is this still your address? Is this still your phone number? Give me your copay, essentially. Like this is what's due right now. So again, those were a lot of the same questions per patient. So we really tried to focus on with Justin's help. Okay, how do we make sure that when our patients walk through our doors, they're fully ready, which I'm putting in air quotes because that's such, I know we're anti buzzwords here, but I'm going to use that patient readiness. We want to make sure that when patients come through our front doors, they walk to the front desk or they check in via their phone. The provider, the receptionist, billing has everything they need from the patient so that patient can immediately be put back into an exam room and see their provider. They're not stuck at the front desk filling out a 20-page new patient packet when they're already 5 minutes late. They're not, upset about like what's due at time of service because they didn't know what was due. They've already paid, they've already done everything. So it's really making sure, okay, let's get the patient back and see the actual provider immediately. They're not spending 10, 15 minutes waiting in a line, waiting to update their information they just did last week. So we really wanted to focus on, again, also reallocating some of the tasks that our receptionists were doing, that very manual, rote, repetitive. Those receptionists, you get really burnt out in that position because not only are you dealing with patients coming in for appointments, you're dealing with patients coming in because I can't get through on the phone. And, it takes a huge emotional toll on those receptionists. So I think in terms of like, staff savings, FTE
Mm.
savings, and reallocating some of that staff to like more, different work. And then just the emotional burden of having to deal with maybe, I don't want to say difficult patients. It's a really difficult time right now financially for like most of the country. Savings them from some of those awkward conversations. It's never fun to be a receptionist and somebody walks in and you have to break the news. Hey, you have a high deductible. Did anyone call you about, you owe $500 for this MRI? That's just your deductible. And having those conversations can get awkward for both the patient too and the staff. As a patient, when you're, hit with that, and then, there's a line behind you, and, there's a bit of like, oh, I wasn't planning for that. And then you're, maybe trying to like move money around from your checking, your savings to checkings, and you're like, oh my gosh. So it's saving those like awkward conversations from the receptionist, in addition to all the other after effects of just making sure the patient's ready and they're in the exam room right away. So what we've done is with Justin is we've utilized LumaPay in addition to our pre-appointment checklist. So what happens is one day before everyone's appointment, they get one link containing all the intake forms they need to fill out for that appointment. They're verifying their demographics. It's updating, no manual intervention, auto updates in seconds, verifying their insurance, and they're also paying their copay. What's amazing about that is if a patient completes all of those items and they're fully ready, it creates a telephone encounter, which it's basically like a note in the chart that says, hey, just so you know, the patient did everything. When they come in to check in, you don't need to ask them all these questions. You can just mark them green, mark them arrived. So it's been wonderful adding LumaPay to that, especially because, and I think we'll probably get more into it, it does post automatically to the appointment. So there's no like manual posting needed from the staff. It just goes right where it needs to within seconds of the patient completing it.
And Emily, you've mentioned, so this goes out the day before their appointment. And you've also mentioned like sometimes it's really painful when you're in the office and somebody's facing like, it's $600 for something that they weren't prepared for. But
Yeah.
you'd mentioned before too that you're almost surprised people are willing to pay these high numbers when they're like in the comfort of their own home and coming prepared. Can you elaborate a little bit more on that?
Yeah. So I think financial transparency is a huge thing. I think a lot of people, they know they sign up for a high deductible. They know there's going to be a cost. I think that sometimes I just think of myself as a patient. I'd rather just know the day ahead and like, have time to plan. Okay, how am I going to afford this essentially? Maybe I, talk to a family member like, okay, like, we need to have this. It's a lot easier than being surprised at the front desk. But even just seeing what you owe is a lot nice. It's nice to have that not sprung upon you when you're walking into a public space. But yeah, people are willing to pay. I think there's something else to be said too from an operational standpoint where, in a patient standpoint, hey, if I wake up and I'm like, I don't really feel like going to that appointment today, but I'm like, oh, but I already paid the copay. Like you're more invested in showing up. Don't have direct stats for that, but that is the assumption that, you're really making them like invest in the appointment before they come in,
And
literally.
what was it like?
Emily,
Oh, go ahead, Justin.
I was going to say, Emily, that's 100% correct. Like, that's part of the reason we like this a lot from me as a LumaPay product manager standpoint, because there is something, I mean, it's a psychological thing, loss aversion. Go look it up. People are afraid, like if they've already spent money on something, they're afraid of losing that thing and losing the opportunity to have that thing. So yeah, loss aversion is real. People show up for appointments simply because they've already paid.
That's like me when I sign up for a workout class and I really don't want to go, but I already paid $60. So I'm in the car and I'm miserable, but we'll do it.
It's why I go to the gym, because I'm too cheap to
I know.
avoid, like, I've already paid. I want to get my money's worth.
That's true. And then, I mean, I do, personally, I will go to some appointments for my physicians that I see, and some of them like don't collect up front. And I'm just like scared. I'm like, what bill am I going to get in the mail here? Like there's always a risk, even if you pay your copay, but it's nice to see, okay, like they did their due diligence. Like the practice looked up like what I owed. They sent it to me ahead of time. There's no surprises. I think people just want to mitigate the risk of surprise when they walk into the office. Because yeah, there is a bit of shame. There's embarrassment. You don't want to have those weird conversations. The receptionist, it's awkward to be like, oh, did you know you owed this much? And that's another thing too we can talk about is the ability to pay the balance as well. So I don't know, Justin, if you want to like talk about that and I could add on, but just the ability for patients to like pay their balance, like with the copay or any amount towards it before the appointment helps, I think, everybody.
Yeah. I think this is part of like, I look at it and say 90% of LumaPay is actually the psychology of payments and like how people think about how they pay for things. There's a reason, Emily, you and I have talked before, there's a reason we encourage people to put the payment at the end of the checklist, because that's when people are going to drop off. So if they can't pay or don't want to pay or can't pay at that moment in time, like they can still come back. So, even simple things like that, it's all really useful. And then I think you've hit on it a couple of times, Emily, but I think one of my favorite things that I've heard from you and other customers is by having this functionality where a staff member doesn't have to actually go and ask that awkward question of like, hey, can I get $300 from you today? Computers will ask that anytime. They'll do it all day, every day without anybody actually doing anything. And they have no qualms about asking for money. Whereas humans, especially if you're in a more rural area and this is your friend Jim down the street who you know is in a bad situation, you're like, I don't really want to ask Jim for this, but Jim might actually have been saving up for this for 3 months because he knows that this is a thing that he's got coming. And so he might be ready to go. But you, because of psychology and humans will human, you feel uncomfortable asking him. So you're like, I'm just going to let it slide. We'll bill it after because somebody's going to take care of this. I don't have to worry about it.
Yes. Yes. And good luck trying to collect some of that money too. We always say that, and there's a lot of like research and studies that show like if you don't collect up front, there's like maybe like 1 out of 3 chance you're going to be able to collect that afterwards. So it is really important to collect up front.
The revenue cycle management statistic I've heard is you'll collect 40 cents out of a dollar if you don't collect up front.
Wow.
Quick question on this process, okay, essentially for the nudge in the psychology to try to get this in ahead of the visit. Before you were doing this, did you have any folks that would just walk out because they were surprised or they got angry?
Yes. All the time. And unfortunately, at the end of the day, we do want to protect everyone involved. I understand from a patient perspective. If I walk in, I'm like, I don't have $1,000 today. Like I'll reschedule, or like I need time to reevaluate if I really need this service. If I'm surprised, like I'll walk out. Also, I'll be like, I need to cancel. I don't want to like get into an argument. Like, can you do a payment plan? Like you're whispering to the receptionist, like, can you do a payment plan? And also, we don't want to put that on the receptionist to have those conversations. We're not asking them to make decisions on if this patient will put them on a payment plan. We would hand them kind of like a business card, like, hey, call the billing office and work it out. So we'd have patients walk out, or, to make sure that we're protecting our staff as well. No, we tell them, hey, if the situation's escalating, just check the patient in and we will handle it after. But again, then we're not collecting those dollars. Everyone involved is upset. Everyone feels this emotional stress because of the interaction. So yeah, it did happen all the time. To Justin's point, I loved how you said, like, you don't know if that person actually did save up. So there's a lot of assumptions made that people who maybe they have a high deductible and they're getting a high dollar service, they're not going to show up. When we turned LumaPay on, I was actually shocked at how many like high dollar payments people were making. So I think there's something to be said too about like removing our own bias. It's like, no, you regularly have patients that make high dollar payments through LumaPay ahead of their appointment. Like, I guess they are willing to pay. You never know what situation a patient is in. They're like, no, I need this service. Like, I need help. So I'm going to pay whatever it takes. I will pay what I owe. So that's another thing too, is like removing that bias.
So question on that. So rough scale here, out of 100 interactions that your front desk team might have previous to the workflow, how many of those do you think were contentious? Was it 3? Was it 10? Was it 8?
Yeah. Well, it depends if you want to break it up. If it's like patients coming in for appointments, if we're just looking at those interactions, I would say probably 10 out of 100. But now it's pretty much 0 because
That's what I was going to ask you.
yeah, there's nobody coming in now that doesn't know what they owe at time of service. Everybody is getting communication. Here's what we're going to ask you at when you check in to pay for your copay or towards your deductible. You can pay it now even, or you can just pay at the desk. But everybody knows there's transparency that, hey, this is what you owe up front for this service.
And how has that impacted the culture in the office, with Lee, with others that see and feel the business impact? Tell us a little bit about that.
Yeah, being like fully forthcoming, I feel that a lot of our staff, and I was in that position as well. They burn out at reception because of all those previous negative interactions. Like, I think a lot of people, you can only handle it for so long, and kind of similar to like call center. They just pretty much get like emotionally beat up all day from those negative interactions. So definitely seeing the morale boost because they're not having those contentious interactions all the time. So people are staying in those positions longer, or, they're not making as many mistakes. They're just
Yeah.
overall, they're just happier. Maybe they're smiling more
Okay.
because no patients are coming in, they don't know what they owe. And a lot of them now too will just have everything done. So it's almost like less work for them. Before they might have been had a, rush check in 60 patients a day, just one person. You're gonna make mistakes. Now, okay, 1 out of every 3 comes in and they have everything they need to have completed, already done. They paid their copay. They're just marking them green. So allows them to take more time too with those more complex interactions.
And Emily, from your experience, what do you think would prevent a health system like Dent from implementing something like this? Like, I recently had a telehealth visit, which I'm like, ooh, fancy. But
Yeah.
then I got a bill in the mail that said to send a check. Like, they didn't even have a website for me to go online and pay. And I was very confused. Like, what are some things that block an
Yeah.
organization from setting something like this up?
I think it's just a perceived notion that if you do tell a patient what they owe, that they're just gonna no show. That, it's like, oh, if we send them a text with
Mm.
a link to pay ahead of it and, we're asking for even $50, I think that, practices are nervous that patients won't show up. But as Justin and I hit on, that's really not the case. And I think people just don't really believe that patients will pay through technology before their appointment. We always look at our own stats for our like highest age group of users of Luma, of our patient population. And you assume it's like, oh, it's going to be like the Gen Z kids and the kids that grew up with smartphones. But that's not the case. Our biggest users of Luma are actually like in older age groups. So again, like removing that internal bias, like, oh, elderly patients would never use something like this. You would be shocked. They want to be by the book and they will learn it. So it's kind of like give them a benefit of the doubt. If you introduce a technology to them, they'll use it. So don't like make judgments about your population with your population bias. I think another thing too is people don't believe in the integration necessarily. So it's like, okay, yeah, I'll send a text link through Luma, but then somebody's probably gonna have to post it and then reconciling it and the billing is gonna be a nightmare. So I think people are very nervous about integrating with another vendor with their EHR, which in our case, it's the integration with LumaPay is objectively better. So I think they're really nervous that they're just like going to transfer work or create more work for themselves.
Yeah, I was
And
going
I
to
think
actually ask you about that. Just one quick thing, Justin. So, what other alternatives did you look at to solve this problem? And why did you decide to work with Justin and his team?
Yes. So a big thing is I always say automation, automation, automation for everything. We need to automate everything we can. So, patients can make, payments on the portal. They can do check-in, they can pay their copay and balance that way. Really the biggest differentiator was not all of the payments that a patient makes. They don't post directly to the appointment. So
Mm.
somebody still has to be like monitoring a page for a lot of those payments and saying, oh, we just got a payment. Let me like associate it to the right appointment. So we're like, we can't do that. Like it has to be in real time. It has to be posting within seconds, which it does, to the appointment exactly where it needs to go. If it's a balance payment, it has to follow for all the billing people, like first in, first out. It has to be able to break it up and apply to the correct claim. So it really came down to, okay, let's not transfer work. Like, yeah, that's great. We're giving the patient some convenience by allowing them to pay online, text. We'll probably collect more dollars that way. But we could probably take it a step further and let Luma or whoever post it to where it needs to go so nobody has to monitor a screen and associate the payment to their correct place. So that was really the biggest and most obvious differentiator. Obviously, it was just the amount of manual posting.
Justin, just would love your thoughts on the workflow. How customized is this workflow? Is it something other ECW users could benefit from? Hey, what if I'm not on ECW? Can this sort of benefit work for others that are leaders like Emily?
Yeah. So, man, that's a good question. Like, I guess I'll start with ECW first. I'm trying to think if there's anything custom we did. I think there's a couple of things around like what the telephone encounter looks like, but that's
Mhm.
about it. And I think we're at I'd have to look at more recent numbers, but I think the last time I looked, we were at like 99.6% automated postings. Not quite 100%. I still say there's room for improvement, but close enough.
99.7 according to some
Yes.
stats I saw.
It's incredible.
There's always room for improvement. I'm an old like Six Sigma guy, so lean 99.99999
Yeah.
would be really ideal. But that's kind of where we're at, and super excited about it. We love that it's posting automatically. To Emily's point, our goal is to really make it as easy as possible, but also support those standard processes that we know everyone in the industry wants, like first in, first out on balances. Like that's a standard. Like, and so we can leverage that. And then I think from the standpoint of other EHRs, like each EHR that we work with at Luma, I think is in a different state based off of what they allow and what is easily integratable. And so I think I would say if you've got questions, like reach out to your CSM who could talk with me. But like I am talking with people probably on a daily basis, and the EHRs range to, on the furthest other end, we do have, automated, but it's using file-based methods where we're doing batch files on a daily basis for some of those EHR scenarios. And it works. It's not as fast. It's not seconds, but it still gets automated posting. And it means that people don't have to spend a bunch of time going through big old files and manually doing every single one. Because I know there's credit card vendors out there who are literally like, here you go, have fun. Here's 1,000 payments, figure it out.
That was our previous vendor. Before we were using LumaPay for co-pays, they would physically swipe the card and they would have to manually post that payment. So it was like $19.99 there. But yeah, it was, to Justin's point, I think it's really important, and it's EHR agnostic. So it doesn't really matter what EHR you have. Everybody just wants an easy way to collect a copay in advance and post it correctly. And it is a standard across EHR specialties. So like, who can do it the best and easiest? And for us, it's been LumaPay.
Do you guys have a number of how many payments you've processed since go live? I think it was around May, given that it's like a 99.7% success rate. I think last time we checked, it was around 5,000. So it's only up from there.
I would have to check. It's definitely, it's
Give me about 15 seconds and I'll find it.
Yeah, it's in the thousands. It's exciting to see.
We are over, I want to say we're close to 300,000, something like that in the number. Yeah, in the
dollar amount coming in.
Dollars been processed. And then I think I'm just opening my data here to see how many transactions.
That's huge.
Yes. And again, if you think about it, those are all dollars just automatically post where they need to go. Nobody's sitting there.
7,400 payments.
Wow, since May.
Emily, how is finance and practice management and RCM? You must be getting free lunches every day.
Well, I will say it's like you don't mess with the money at any organization. So if they're happy, we're happy. If dollars are coming in and they're getting posted and it's not creating a bunch of work for other departments, they're happy. So yes, it's really amazing to see. Everyone is very happy. I think, anyone working in finance, there's always a healthy level of skepticism of like, I will see how many patients actually use it. But
I think Jen actually likes me at this point, right? Emily?
Yeah. Yes. And I always tell everyone, I'm like, and they should be, like our CFO billing. It's like they should be very skeptical. You can't mess around with the dollars. Like this is really impactful. It determines whether we keep our doors open or not. Like we have to make sure the process is as smooth as possible. So when Justin's like, I'm not happy with 99.7%, it's because the financial world and revenue, as you know, there's no room for error. It has to be perfect. So we are nearly there, but I think we're pretty dang close. So yeah, there's a lot of excitement. And then, now I have other departments like hearing about it. It's like, we're automating copays, but they're like, oh, can you create a message template for me for psych televisits? Because we like to send that out ourselves. Departments that were a little fearful of some of these like Luma integrations and automations, now they want in on it because they see it's so successful. That goes for other things outside LumaPay, like scheduling, for example. So it's gotten a really good reputation and makes people believe in it.
That's so good. So, all right. So just let's hit the rewind on the tape for a second. So for a new person if you bumped into them in the airport and they said, I have this problem, what would be the 3 steps you'd say you should do this, this, and this to attack that problem? What would those be?
Well, what's the problem? I guess that depends on.
That they had the same
Yeah.
post-payment collection, the same dysfunction of their staff having to tell people no.
Yes. I would say that the first thing is to reevaluate how they're informing patients about their copay. Start slow. It might start slow with, hey, maybe don't insert the payment link right away, but see what happens in regards to your interactions, the receptionist interaction with staff. If all you do the day before the appointment is say, hey, this is, don't forget, this is your final reminder. You have an appointment tomorrow. By the way, this is what we're showing for your copay amount. Just do that and get patients kind of used to getting a text that says what they owe at time of service. See how those negative
Mm.
interactions at the front desk drop, and then build upon that. Then maybe consider, hey, let's actually add a payment link here. That would be the second one. The third one is, I don't know, take them all out to lunch. Maybe that's the third one. Take me out to lunch after I fix your problems.
Well, that's, food travels, so that's easy.
Yeah. But yeah,
Ange,
so yes,
yeah.
that's what I would do.
No,
Ange, any thoughts? I mean, this has been pretty sick.
this was so dense and chunky, full of so many good bits. Like I learned so much as well from this
I
time.
know.
I loved it today. And as
I do have actually one more I have one more question, I
Yes.
promise. Okay, so, and I'm kind of infatuated with like the impact to the patient. Okay. So if you're sending this link beforehand now, and it's a better experience, you're already saying that, oh, people are responding really well.
Mm.
So we've turned the tide there. How are you thinking about those that might cancel? Are you thinking about now injecting a rebook process, a wait list ability? Is there anything you're doing in that little space to
Yeah.
try to recover early enough when somebody recognizes, oh my gosh, I'm so glad actually they told me this because now I can, so I see you smiling, nodding. What is that workflow right there? If just for another minute or two, because I would have to think others are struggling with that.
Yes. We're a specialty, like many other organizations, for these last minute cancellations, because they happen. Maybe, somebody does get the text and like, I can't pay that. I got to reschedule. I got to cancel it. I can't make the appointment. That slot opens up and for whatever reason. It could be because of the payment. It could be for whatever. We use the smart wait list and rescheduling to fill those slots. At any given time, we have some providers that, for their subspecialty, they're booking out quite a bit and they
Mm.
have a lot of patients on their wait list already. So I hate to say it's like, people are willing to come, and we're going to find patients that like, oh my God, there's an opening tomorrow. Like somebody canceled, I can get in now. So you're going to be able to fill those slots, even if
Oh, it's so cool.
yeah.
That's so cool. I mean, that's just like a knock-on benefit to what you have done.
Yes. Yeah. So maybe that's the third thing that I would recommend is if they're going to turn on, text to pay, the co-pays, the links beforehand. If
Yeah.
they're so worried about patients canceling, if they still have that preconceived notion that, oh, if we send them what they owe ahead of time, they'll just like not, they'll cancel. If you're really worried about that, then why don't you also use waitlists in conjunction with it? I think you'd be hard pressed to find an organization, a practice in this country right now that doesn't already have like a paper waitlist, some sort of waitlist where, they do have patients that are willing to come in no matter what the copay is. Like they just want to come in. So definitely supplement those worries with some of those automated scheduling features.
Oh, that's so cool. Justin, were there any last thoughts? I mean, I know Angie and I twisted your arm to come on here.
I think we talked about it a little bit, but I think like Emily, one of the things that we turned on recently was adding the balance to the copay collection. I'm curious, 'cause I haven't actually asked you this recently, but how are you feeling about that? I know we talked about people are paying more than you expected.
Yeah.
How are staff accepting it? How's Jen thinking about it?
Yeah. Well, again, it's happening on the back end. Nobody really knows about it. All billing is seeing is
Money.
dollars coming in. They're just seeing somehow, hey, this patient paid off their balance. Not really sure how. I'm like, oh, it's because, we give them the option to also pay part of their balance, all of their balance when they're paying their copay also.
Yeah.
So
Yeah.
for everyone else, they kind of don't even realize what's going on. They're just seeing like, oh, now we have less patients who have an outstanding balance. Like they are willing to pay. It is cool also to see, like, yeah, patients, if you show them what their balance is and give them alternative methods to pay that, like they will. They actually will. Instead of us having to spend money to send a paper statement out like once a month, they're just doing it, before their appointment. I just did it recently too. "Oh, I have a $20 copay, but I have like a $50 outstanding balance. Let me just pay it all off at once." Or, people like to budget. They might see, I do have kind of a high balance. Like, let me pay my copay today, but let me just try to pay like 50 towards the balance at this time. They don't have to pay the whole thing, but they might want to chip away at it slowly. So give them the tools and people can self-manage.
Oh, this is so great.
Well,
Well,
can you
Ange,
bring
I
us
know
home?
yeah, you want to take us home and do
Yeah,
some
we have
rapid
our
fire?
Funsies Rapid Fire. We have new questions for you today, Emily. So ready, set, go. You get to teleport anywhere for dinner tonight. Where are you going?
Lima, Peru, easy.
I was expecting buffalo wings in upstate New York.
Well, I was just in Buffalo, so I had way too many wings. But Lima, Peru, the best food in the entire world. I will die on that.
Awesome. And now you're on a reality show, Survivor, Shark Tank, or Love Island. Which one do you go to?
Well, I'm married, so maybe not Love Island, but Survivor, without a doubt. I'm a mountain girl now. I think I
Yeah.
can do pretty okay.
And last question. When friends and family come visit you out in Wyoming, where do you take them?
Easy, the North Fork of the Shoshone, which is the road that goes into Yellowstone. I might not take them
Mm.
hiking because a lot of grizzlies.
Mm.
Well, maybe I'll just give them bear spray, see how brave they are. But I think it was Teddy Roosevelt said it was the most scenic drive in America.
Wow.
You need to get us some pictures from your phone. I'm sure you guys have taken some amazing pictures.
But yeah.
I
Oh,
mean,
you
that's
have to see
just
her wedding photos.
that's just
Have you
gold.
seen them?
Yeah,
Well,
I
I
I
mean,
got married in a negative 35-degree weather outside,
It
so they're
You
crazy.
could see snow sickles on her husband's beard and her eyelashes. It's
See,
magnificent.
this is why I would do awesome on Survivor. I've already
Yeah.
done it. It's fun for 0 money.
I think Taylor Sheridan needs to cast y'all in his
I
next
know.
whatever the spinoff's gonna be.
I agree. I know everyone's like, "Oh, is where you live, is it like Yellowstone?" Like, yeah, I'm like, "It kind of is, actually."
Yeah,
It really is, like, I don't know, inspiration for the show.
yeah.
Yes, I'll have to hit him up.
Well, you rock. You're amazing.
Mm.
Thank you for dropping all this knowledge. Thank you for dreaming big.
Yes.
And
Thank you, Justin, for helping build all of this amazing
yes.
stuff. That's amazing.
I think he's the real hero here. I'm just regurgitating what he's built.
Well, Emily, we know you're head of product, head of design, head of everything at Luma Health today.
Right.
So I don't believe that.
The real Hefe.
Yeah, exactly.
All right, y'all.
Thanks all.
Thank
We'll
you.
see
so
you
much.
soon. Bye.
Bye.